Good evening and thank you for joining us. Canada is expecting a shipment of surgical face masks to arrive in the next 48 hours. It's a much needed supply, but what's really in demand is N95 respirator masks. Those are proving to be a bit more challenging to get. President Donald Trump warned manufacturer 3M to stop exporting them to Canada and Latin America. Prime Minister Justin Trudeau says his government is still in talks with the Trump administration about the importance of keeping essential medical supplies flowing across the border in both directions. But as David Akin reports, Canada isn't planning any retaliatory measures against a longtime ally.
Unlike surgical masks, tight-fitting N95 masks can stop the droplets that may contain the COVID-19 virus, and that makes them a crucial tool for frontline healthcare workers. They're also in short supply, a supply that may get worse after a White House order that a key American manufacturer of N95 masks, that's 3M, must stop exporting them to Canada and Latin America.
We need the masks. We don't want other people getting it.
Canada is now pressing the Trump administration to reverse that call.
We're also continuing to impress upon countries around the world that they are hurting themselves when they limit the flow of essential goods across their borders.
Meanwhile, Canadians are helping keep America safe. For example, 1,500 Canadians from Windsor, Ontario, go to work every day in hospitals and clinics in Detroit, Michigan. In Nanaimo, BC, a mill is working round the clock, turning a special kind of cedar found only in Canada into a pulp that is a crucial ingredient for American makers of protective gear.
Our pulp is going into surgical gowns, masks, drapes, all those kind of good things.
Trudeau does not want to engage in tit-for-tat export bans.
We are not looking at retaliatory measures or measures that are punitive. We know that it is in both of our interests to continue to work collaboratively and cooperatively to keep our citizens safe.
But Ottawa is ramping up domestic industry to produce N95 masks and other gear. And it's also going to global markets. Up to 8 million surgical masks are en route right now from China. And not only that, but the Canadian government has rented a warehouse in China to help with the acquisition of more made-in-China personal protective equipment.
We have been working day and night to source medical supplies for Canadian frontline workers.
And of course, this is one of the great ironies of this crisis. Canada is looking for help from a country, China, with which it has been at odds with for much of the last 2 years, while its best friend and ally next door refuses to help. Robin?
David Akin in Ottawa. Thanks, David. Trudeau will speak with Trump in the days ahead and will likely point out that Canadian nurses work across the border and Canada has supplied the U.S. with test kits and gloves. The U.S. has the most cases of COVID-19 in the world. More than 8,000 people have died, 1,100 people in the last day alone. There's a global competition among countries to secure what they can to fight this pandemic. Germany accuses the U.S. of swooping in and stealing face masks, which President Trump is now calling on all Americans to wear in public. But Canada's chief medical health officer says right now they must be reserved for the front lines. Jennifer Johnson reports.
The changing face of America in its war against COVID-19. All citizens now being told to wear some kind of protective mask while out in public. The Centers for Disease Control warning that people with no symptoms who talk or even breathe can spread the virus.
There's a greater number of people that are asymptomatically infected than we previously thought.
The new guidelines are in stark contrast to previous recommendations when government leaders and the World Health Organization downplayed the importance of masks. But a 5-year study published Friday in the science journal Nature found that any simple mask blocks 100% of coronavirus droplets and aerosol.
You may generate droplets that are invisible. They're so tiny you can't see them, but they're certainly big enough to carry a virus if you happen to have it in you when you're talking.
Still, Canada's top doctor says they are not ready yet to issue the guideline.
We need to reserve medical masks for healthcare workers. Some of these personal protective equipment is in sort of scarce supply situation, and we need to prioritize people who are looking after the sick.
Adding to the confusion, President Trump is backing the new CDC recommendation, but says he will likely not wear a mask himself, even as he makes this grim prediction.
This will be probably the toughest week between this week and next week. and there'll be a lot of death, unfortunately.
As hospitals across the U.S. continue to battle mask and other equipment shortages, some healthcare workers are comparing their shifts to suicide missions.
This is life or death. Every hospital in the state of New York and across the United States should have the supplies they need.
But finally, some good news for hard-hit New York, the state with the most deaths. It is getting over 1,100 donated ventilators from China and Oregon.
I want this all to be over. It's only gone on for 30 days since our first case. It feels like an entire lifetime.
President Trump has still not ordered all states to institute stay-at-home orders, as a handful hold off. Along with masks, the White House is still strongly encouraging social distancing as America struggles to get this pandemic under control. Jennifer Johnson, Global News, Washington.